So let's define nursing documentation. This means clear, accurate. So what do you mean by accurate? It is correct in all details. And accessible documentation that is an essential element of safe, quality, evidence-based nursing practice. Documentation is necessary and integral aspect of the work of registered nurses in all roles and settings. So basically, clear and accurate documentation is the nurse's best defense against potential liability. Okay, ano bang ibig sabihin ng potential liability? No, ito yung ating best defense against sa liability. Say for example, merong pasyente na nagkaroon ng lagnat, no? For example, pediatric patient, may fever siya, and naglapit yung parents sa nurse's station and sinabihan yung nurse na may lagnat yung pasyente nila. So, tinignan ng nurse yung doctor's order, yung chart, kung meron bang PRN medication or as needed na medication na order si doc, paracetamol para mawala yung fever or bumalik sa normal body temperature. Okay, so ang ginawa mo, binigyan mo ng paracetamol yung pasyente na may lagnat, yung bata. Later on, nagkaroon ng convulsions yung patient and nagalit yung pamilya kasi bakit pa rin nagkaroon ng convulsions, hindi pa rin bumaba yung lagnat ng pasyente. So, may tendency na pwede ka isu ng family, no? Kasuhan ka, kasalanan ng nurse, no? May mga ganyan ng mga pasyente. No, kasi daw akala nila hindi mo binigyan ng paracetamol yung patient kasi nag-iba sila ng watcher, nag-change ng watcher. No, umalis yung parents, ang nagbantay na naman is ibang watcher, maybe uncle or auntie, and then yun, nag-convulsion yung bata noon and sinabihan, wala siguro nagbigay yung nurse ng paracetamol or ng gamot kaya nag-convulsion yung bata, yung pasyente namin. Okay, may mga instances na ganyan. Pero, you were able to document everything sa nurse's notes, sa medication sheet, as well as na note mo sa TPR sheet, temperature, pulse, respiration, ang kanyang body temperature at that time na may lagnat siya. Because of that body temperature, for example, 39 ang kanyang body temperature, may doctor's order na PRN medication na paracetamol, no? So, binigyan mo siya, nag-sign ka doon sa medication administration record, may time din, tapos ang charting mo, ang nurse's notes mo, nilagay mo doon, ang problem is nagkaroon ng fever, febrile yung patient. Okay? Nag-charting ka doon, ginawa mo yung mga nursing actions mo. Okay? Kaya ang documentation, siya ang best defense natin against potential liability. When talking about liability, ano pa yung liability, ma'am? No? So, ano ba yun? Liable ba tayo dyan? Liable means responsible by law. No? Legally answerable by law. Ay, legally answerable natin. No, ano yung ginawa natin sa pasyente, ano yung nursing actions natin, responsible tayo dyan. Pero ito, may defense tayo against that. Kasi nga, na-document natin lahat. Okay? So, yun siya ang about sa nursing documentation. Bakit importante ito siya? What will happen if the nurse failed to properly document? Anong mangyari? So, it can constitute negligence and be the basis for tort or liability. Wrongful act yun siya, yung tort. Okay? Examples of tort or wrongful act, pwede magkaroon ng physical harm sa pasyente mo, pwede battery, assault, damage to personal property, etc. Yan yung examples ng tort liability. Okay? So, pwede ka makasuhan yan kung hindi mo, fail mo to document your nursing actions or negligent ka. Okay? So, kaya importante ang nursing documentation. Now, what's the uses? What are the uses of nursing documentation or purposes ng documentation natin? So, nursing documentation are kept for a number of purposes, including yung number 1, communication, then planning client care, auditing, health agencies, research, education, reimbursement, legal documentation, and healthcare analysis. So, we will tackle this one by one, pero mabilis lang. Okay? So, number 1, communication within the healthcare team. Ang information nito is communicated verbally and in written and electronic formats across all settings. So, examples niyan, assessments. So, pwede yan siya verbal or written, ang mga assessment through endorsement, then sa chart. Clinical problems na present sa patient natin. Okay? Communications with other healthcare professionals regarding the patient. Okay, very self-explanatory. Then communication with and education of the patient, family, and the patient's designated support person and other third parties. Then yung MAR or Medication Administration Record. So, dyan tayo nagsasign ng ating binigay na meds sa patient. Medication sheet. Order acknowledgement, say for example, nag-order si doc sa doctor's order, then nagpirma tayo doon, it means na-acknowledge natin yung kanyang order and i-carry out natin yun. Okay, that's the implementation and management. Then patient clinical parameters, so say for example, nahirapan huminga si patient, so naglagay ka ng oxygen, so ni-record mo yung oxygen saturation niya, so may mga parameters yan, kung nagbaba ba, nagtaas ba, so yan yung mga examples. Patient responses and outcomes, including changes in the patient's status, then plans of care that reflect the social and cultural framework of the patient. Okay? Yan yung communication within the healthcare team. Next is the communication with other professionals. No, hindi lang yung healthcare professionals, yung ibang professionals pa. Through credentialing. So, ano daw meron dyan sa credentialing? So, they are going to review the client records for quality assurance purposes. Meron accrediting agencies such as the Joint Commission. They may review client records to determine if a particular health agency is meeting its stated standards. Okay? Then for the legal, so sa legal naman, legal documentation, sabi dito kapag incomplete, inaccurate, untimely, illegible, or inaccessible, or that is false and misleading, can lead to a number of undesirable outcomes, no? Including kapag kulang daw or hindi klaro, hindi siya accurate, no? Pwede kang makasuhan. Impending legal fact-finding, jeopardizing the legal rights, claims, and defenses of both patients and healthcare providers, kasali ang doktor, kasali ang nurses, no? Putting healthcare organizations and providers at risk of liability. Kasi naman, ang client's record, isa siyang legal document and is usually admissible sa korte as evidence. No? In some jurisdictions, the record is considered inadmissible as evidence kapag nag-object yung pasyente because the information given by the client, no, sa doktor is confidential. So pwede yung mangyari yung ganun. Then for the regulation and legislation, audits of reports and clinical documentation provide a method to evaluate and improve the quality of patient. They maintain current standards of care or provide evaluative evidence. Okay, so nire-regulate yan para ma-evaluate or improve yung quality of patient care ng mga nurses, doctors, or ibang healthcare professionals. So for the reimbursement, documentation is utilized to determine the severity of illness, the intensity of services, and the quality of care provided upon which payment or reimbursement of healthcare services is based. So, pwede magkaroon ng reimbursement sa PhilHealth as long as pinapasa natin yung chart doon sa kanila. So, trabaho yan yung medical records para magkaroon ng reimbursement sa hospital. Yan yung sa PhilHealth, sa Medicare, or any other, tawag nito, yung mga MaxiCare, Coco Life, yan sila. They can give reimbursement. Next is about research. So, sa research, the information contained in a record can be a valuable source of data for research. The treatment plans for a number of clients with the same health problems can also yield information helpful in treating other clients. No? So, magamit siya sa research yung documentation. Then, quality process and performance improvement, yan yung sa mga staff. no, yung nurses, healthcare team members, groups of healthcare providers para ma-improve no yung performance nila. Pwede gamitin, tignan nila yung documentation as primary source of evidence. Okay? So, sa next natin na topic is about nursing process. Kasali ito siya sa nursing documentation. No, we still need to use this. Natutunan nyo na itong nursing process doon sa NCP, how to make NCP, diba? You still need to follow this. So, nursing documentation is aligned with the nursing process and reflects the principles of assessment, planning, implementation, and evaluation. Yan yung nursing process. It is continuous, and nursing documentation should reflect this. So, ito na yun. Meron tayong assessment, no, sa nursing process. First, assessment. I-assess natin yung pasyente. Mag-collect tayo ng data, subjective, objective. Then, we are going to organize the data and validate the data and document it. After assessing the patient, subjective and objective, we are going to diagnose, no? What's the problem? You need to analyze, you identify the problems, health problems more specifically, the risks and strengths, okay? Then you formulate the diagnostic statement. So, pwede tayong gumamit din ng NANDA dito. Then, for the planning, we need to prioritize problems or diagnosis and formulate goals, desired outcomes, select appropriate nursing interventions, and write the nursing interventions. So, ngayon, alam na natin, na-plan na natin kung ano yung dapat nating gawin, anong nursing actions and interventions for a specific problem. We are going to implement it. Okay, implementation, we need to reassess the client after, determine the nurse's need for assistance. No, kailangan ba ng collaboration with other healthcare professionals? Then, implement the nursing interventions, supervise delegated care, and document nursing activities. Lastly, evaluation or evaluating. So, you will collect data related to outcomes. Ano ang response ng pasyente? Okay, sa iyong nursing interventions. So, that's it for the nursing process. So, the next topic will be about the So, ito siya yung example ng narrative charting. We still use this sometimes, depende lang sa hospital na tinatrabahuan mo, no, yung narrative charting. So, ito yung example nila. So, may situation. Ito yung nangyari sa pasyente. The client is post-operative day 2 after abdominal surgery. So, questions to ask yourself. Tanungin mo ang sarili mo, no? What assessment data are relevant? Ano yung mga important or related, no? Sa assessment, yung importante. What nursing interventions have I completed? Anong ginawa mo na actions or interventions? Then, what is my evaluation of the result of the interventions? And or what is the client's response to the interventions? Okay, so, itong 1,000 military time yan, okay? Military time yan siya, 10 o'clock. Diminished breath sounds in all lung fields with crackles in left lower lobe. Not using incentive spirometer or IS, yan. Pwede ka maggawa na medical abbreviation shortcut sa next mo na pagsulat dito. Stated his, so meron siyang quotation na ginamit, no? Subjective ito. Not sure how to use it. Okay? Then temperature, 99.6 degrees Fahrenheit. Instructed how to use IS or incentive spirometer. Discuss the importance of deep breathing and coughing after surgery. Administered analgesic for abdominal pain, rating of 5 out of 10. After pain relief, no, ng kanyang pain scale is 1 out of 10 na lang. And then, able to demonstrate correct use of incentive spirometer. Then, may line lang dyan, para hindi na malagyan ng ibang words. Then, yung name ng nurse, RN. Then, later on, military time na naman, using incentive spirometer each hour, lungs less diminished with fewer left lower lobe crackles. Then, temperature nilagay niya. So, very simple ang narrative niya. No, parang storytelling. Yan siya. Okay? But we will focus sa focus charting or FDAR. Before FDAR, meron tayong SOAPIE or SOAPIE R. May dinagdagan ng R. Okay, yan yung subjective data, information obtained from what the client says. Then, ang O is yung objective data, kung ano yung nakikita natin. Information that is measured or observed by use of the senses. No? So, ang subjective, yan yung quotation. Objective, kung yung mga signs, no? Nating nakikita, na measure natin by the use of our senses. And then, A is the assessment or interpretation or conclusion drawn about subjective and objective data. Statement of the problem. No? So, ito yung iyong diagnosis. Then, the plan of care designed to resolve the stated problem. Interventions. Ano yung ginawa na specific interventions na ginawa ng nurse to relieve the patient's illness or problem na na-identify natin. Then, E is for the evaluation, client's responses to nursing interventions and medical treatment. Then, if kailangan pa i-revise, merong R, revision, care plan modification suggested by the evaluation. Okay, so itong SOAPIE, dati ito yung ginagamit talaga. Nakaabot pa ako nito way back 2016. Last gamit ko ng SOAPIE is 2016. 2017, nag-FDAR na. Pero since 2016, nag-start na mag-use ng FDAR noon. Pero may ibang hospitals lang na still, SOAPIE pa rin yung progress notes, no? Yung ginagamit, nurses notes natin. So, ito siya, kapag ang pasyente mo is 30 plus, no? Kadami-daming pasyente sa ward, tas SOAPIE ang gamitin mo. Hanapan mo ng subjective, objective cues, no? Kailangan mo magdala or mag-borrow ng NANDA para lang mahanapan mo siya ng diagnosis niya sa assessment mo. Plan of care, magsulat ka pa para siyang NCP. Okay? Then your interventions, then your evaluation. So, may goal met, may goal unmet pa rin, mga ganyan. Okay, so grabe, consume siya ng time kung nag-duty ka and marami yung census, mataas ang census, maraming pasyente. So, buti na lang ngayon is change na nila, FDAR na ang ginagamit, more on focus charting. So, meron din tayong PIE or PIE. This is the problem, intervention, and evaluation. Wala nang subjective, objective, diretso na siya sa problem, ang P mo. No? Acute pain. So, ang pain scale niya, 8 out of 10. Then, ang intervention niya, ayan, nilagay na dyan lahat. Past tense ha, kung gagawa. Past tense na kayo, nangyari na. No? Provided, allowed, back rub done, instructed. Yung mga action words, dapat past tense siya. Okay, then yung evaluation, past tense din. Identified use of techniques to control pain and discomfort. Able to report that discomfort is minimized. Able to rest between contractions. So, madali lang din itong PIE or PIE. So, ito na talaga yun, yung DAR, Data Action Response, or FDAR, Focus Data Action Response. So, ito na yung ginagamit natin ngayon. Mostly, lahat ng hospitals, ito na ata, FDAR na talagang ginagamit. Okay? F, focus. This is the focus, the condition. Pwede siya condition ng pasyente. Pwede nursing diagnosis ang gamitin. Say, for example, pain, acute pain, altered comfort, activity intolerance, mga ganyan, mga nursing diagnosis. That alone. Behavior ng pasyente, signs and symptoms, acute change in client's condition or a client's strength. Pwede rin strength. Pwede sabihin mo, health teaching. Pwede lang din health teaching ang iyong focus. Then, ang data, ang letter D, yan yung assessment mo. Observation sa client status and behavior. Diyan na papasok yung subjective, objective cues. Pwede subjective lang ilagay mo. Kung yun lang talaga ang yung quotation, no, ilagay mo lang anong sinabi ng pasyente, sakit akong tiyan. Okay? Yun, lagyan ng quotation. Then, ang iyong objective is pain scale of, ano yung pain scale na sinabi ng pasyente. Okay? So, pwede yun siya. Say, for example, ang focus mo is pain. Then, for the A, action. Action is planning and implementation, immediate and future nursing actions. So, dito sa A or sa action, past tense lahat. So, kung may pain ang patient, ang anuhin niya is encourage to do distraction methods, ganyan, administered pain medication, past tense na. R, response. Ano yung response ng pasyente? Yung evaluation natin. Client's response to any nursing and medical care. So, pain scale decreased from, okay, doon mo na ilagay yung response. Or, pwede rin quotation marks yung galing sa pasyente, yung verbalization niya na, ma'am, wala na sakit, ako ang tiyan. Pwede yung ganun. Okay, then pirma na. So, may example dito, date and time. So, kunyari, 7 to 3 ang shift mo. Pagka alas 9, nag-complain ang pasyente ng pain. So, that's your focus, pain. So, saan banda na pain? More specifically dito, makita natin sa data. No? So, abdominal incision pala. Guarding abdominal incision. Facial grimacing, no? Grimace face noted, pwede rin ganon. Rates pain at 8 on scale of 0 to 10. Okay, so pwede yan siya. And for your action, past tense na, administered morphine sulfate 4 mg IV. So, pwede mo isulat yung medications dito na binigay mo. Okay? Then, other nursing interventions pa, pwede lang din siya ilagay dyan. Then, at 9:30, ano nangyari? So, binigay naman ang medication. So, within 15 minutes, mag-okay na, mag-work na yan siya kasi IV man. 15 minutes yan siya. 10 to 15 minutes mag-work. So, pagka 9:30, nag-rate na ang patient ng 1. Okay? States willing to ambulate. So, yan lang. Very simple ang FDAR. Madali lang magawa ng FDAR kasi focus nga siya on that certain problem. No? And ano yung ginawa ng nurse? Dapat totoo din na ginawa mo. Okay, remember lang na past tense ha. Past tense ang gamitin ninyo dito sa action. And sa response. Sa response, pwede yung rates pain, no? Yung present. Or pwede past tense na din. Now, we will talk about the documentation, do's and don'ts sa ating focus charting. So, ano ba yung pwede natin gawin or yung mga do's natin? Do read what other providers have written before providing care and before charting. So, for example, 7 to 3 shift ka na nurse and yung 11-7 na duty, ang charting niya is abdominal pain. Tapos, sa ano mo pa rin, sa shift mo, meron pa rin siyang abdominal pain. So, pwede ka na maghanap ng ibang problem. Kung wala talaga ibang problem, so, pwede pa rin na yun pa rin ang gamitin ninyo. Okay? Abdominal pain pa rin. Kapag wala ka na ibang mahanap na ibang problem. But usually, abdominal pain in 8 hours, dapat ma-relieve na yan siya. So, ibang problem na naman dapat sa shift mo. Or kung walang problem, pwede naman health teaching ang ilagay mo. Okay? Then, do time and date all entries. Very important na may date and may time. And do use flow sheet, checklist. Di ba may checklist tayo? Kung mag-rounds tayo, punta tayo sa kwarto ng pasyente, meron tayong flow sheet. Or flow sheets na gamitin, checklist, physical assessment ng pasyente. To keep information on flow sheet, checklist current, dapat updated. Do chart as you make observations. Okay? Then sa don'ts natin, bawal, don't begin charting until you check the name and identifying number on the patient's chart on each page. Baka iba ang na-chartingan mo, no? Nagawan mo ng nurse's notes or ng FDAR, iba na patient yun. So, check pa rin ang name ng patient. Then, don't chart procedures or chart in advance. Hindi mo alam anong pwedeng mangyari sa shift mo, di ba? So, advance kayo ka, lahat din nagtabo sa imong shift, iba pala ang nangyari. Then, don't clutter notes with repetitive or frequently changing data already charted on the flow sheet or checklist. Paulit-ulit. No? So, wag lang yung paulit-ulit. So, pwede lang na simple lang, kung ano talagang ginawa mo on your shift, yun lang talaga ang i-chart mo din. Okay, wag na paulit-ulit. Meron na yun doon sa flow sheet, wag mo na iulit lagay doon sa iyong FDAR. Okay, then next. So, meron pa pala sa do's natin. Do write your own observations and sign over printed name. Sign and initial every entry. Kailangan mag-sign and ilagay mo yung full name mo with your license number. Then, pag nurse, countersign lang ng CI. Do describe patient's behavior. Do use direct patient quotes when appropriate. Do or be factual and complete. Record exactly what happens to patient and care given. So, for example, no, ang accurate documentation, paano ba naging accurate yung documentation? So, it should include all data collected about the client's health status. So, ano yung factual manner daw? and not interpreted by the nurse. Bawal yung na-interpret natin. Dapat factual manner. Say for example, nag-record tayo ng breakfast ng client, intake natin. Intake pala niya. Okay, objective data. Coffee, 240 ml. Juice, 120 ml. 1 egg, and 1 slice of toast. Yun ang isulat mo sa kanyang breakfast na intake. Okay? Objective data kung ano yung nakita mo, di ba? Meron siyang coffee pero 240 ml. So, merong measurement, no? Juice, 120 ml. Isang egg, 1 slice of toast. Yun dapat ang isulat mo. Rather than, wag mo ilagay na appetite good. No? So, judgment yan. Interpretation yan ng nurse. Appetite good. So, hindi pwede yun ha. Kasi judgment or conclusion such as appetite good or kung ilagay mo normal appetite, may ibang meaning yan siya sa ibang mga tao. For different people. May have different meanings for different people. Iba-iba ang ating judgment kung ano yung good appetite sa atin or normal appetite para sa atin. Iba rin para sa kanya. Okay? To increase accuracy, the nurse records subjective data in the client's own words. Kaya, we will use quotation marks. Okay, yung subjective data. Quotation marks ang gamitin natin. Sakit akong tiyan. Then, quotation. No? Restating, in other words, what someone says increases the chance of changing the original meaning. Okay, so hindi tayo mag-restate. Dapat quotation kung ano mismo sinabi ng pasyente, yun ang ilagay natin. Okay? Yan yung sa don'ts, no? Don't make or sign an entry for someone else. Bawal yan siya. Kasi hindi naman siya ang gumawa ng nursing actions or naka-observe sa patient. Ikaw naman ang nandyan sa shift mo. Ikaw yung nurse na assign sa patient na yan. Don't change an entry because someone tell you to or told you to do so. Okay? Bawal yan. Don't label a patient or show bias. Bawal ilagay na patient is lazy. Mga ganyan. Wag yan. Okay? Bawal ang label. Bawal labeling. Then, don't try to cover up a mistake or accident by inaccuracy or omission. Okay? Then, don't white out or erase an error. Bawal yan mag-white out or mag-erase po. Okay, depende sa hospital, sa protocol ng hospital, ano ba sa kanila, mag-crush out, then kung may mali, crush out, and then may signature mo, then put the correct word na gusto mong ilagay doon. Pero, dapat talaga walang mali, no? Walang erasures. As much as possible. Okay? Then, don't throw away notes with an error on them. So, yan yung do's and don'ts ng FDAR. So, ito, may example tayo ng focus charting. Isa-isahin natin, ha? So, sabi doon, dapat may date and time talaga. So, nilagyan niya ng date and time. Focus at 10 a.m. na-complain ang patient ng chest pain. Ano ang data natin? Okay, quotation, no? Yung sinabi mismo ng pasyente, ha? Subjective. Sumakit ang dibdib ko. Okay, yan. Nilagay niya. Then, objective cue mo, ano nakita mo, na-observe mo. So, very specific, no? Accurate daw. Okay? Mid-clavicular line. Okay? Ang pain is a mid-clavicular line and pain of 4 on scale of 5. Okay? Bakit 4 on scale of 5? Baka 1 to 5 lang ginamit niya, hindi 1 to 10. Dito na pain scale. Then, sa action niya, ang ginawa niya is nag-medicate siya ng Isordil 5 mg sublingual. Okay? Then, wala mo na siya dito sa baba, ewan ko ba siya naglagay ng name dito, pwede na wala lang lagyan ng name dito. Doon na sa last part, maglagay ng name and signature, okay? Disregard this one. Then at 12 noon siguro to, hindi to siya AM, okay? 10 AM, 12 noon, or 12 PM. So, pwede na hindi na maglagay ng chest pain dito. Okay, kasi meron na yan dito. Kung tuloy-tuloy mo na yan siya na DAR, okay, resting in bed, or pwede seen resting in bed, and then yung kanyang sinabi, quotation, na bawasan na sakit ng dibdib ko, rating of 2. Okay, then you sign your name and then your signature. Okay, so yan yung siya sa focus charting. Okay, next example. So this is the next, hyperthermia, or pwede fever, pwede hyperthermia ang ilagay. So data, ilagay niya increase in body temperature above normal range, temperature 38 degrees Celsius, axilla, flushed skin and warm to touch. Okay, other nurses, pwede lang ilagay na body temperature of 38 degrees Celsius. So, ito, mahaba lang yung nilagay niya. So, depende lang yan sa iyo. Okay? So, sa action niya, so kulangan lang siya ng date and time dito sa side. So, action, anong gawin mo para mawala ang hyperthermia? So, past tense ha, tepid sponge bath done, instructed, SO significant other, to let patient wear loose clothing, instructed SO to provide blanket to patient when shivering, instructed SO to let patient drink lots of fluid, instructed SO to include in his diet foods rich in vitamin C such as oranges, to include, instructed ang watcher no, to include sa patient's diet. So, inaalagaan siguro dito ng watcher yung patient, baka yung patient dito is bedridden. So, doon ka na sa, bakit ganito? Okay, wait, sorry. Instructed SO to let, okay, ang watcher ang nag-aalaga sa pasyente. So, sa watcher ka nagbigay ng advice, no? And provided opportunity for patient to rest and due meds given. So, pwede ito siya na actions. Then, response mo at 1 p.m., patient was able to rest, then patient's temperature decreased kulang ng D to 37.8 degrees Celsius. Okay? So, sa amin, sa ibang hospitals, no, ang aming charting, for example, pwede 10 a.m., pero ang aming closing is at, kung 7 to 3 ang shift, ang response namin lahat 3 p.m. No, kasi tapos na, doon ang response lahat. Kasi pwede may mangyari sa 2:30, 1:30, 1 p.m. to 45 p.m. No, aside sa hyperthermia, pwede pa siya magkaroon ng, for example, nag-abdominal pain siya. So, pwede mo isingit ulit doon. So, ang charting mo niyan, say for example, hyperthermia, data ng hyperthermia action, then at 9 a.m. man yung action mo, no. Then, mga 1 p.m., no, nagsakit ang tiyan niya. So, pwede ka ulit maglagay ng bagong focus. So, huwag ka muna mag-close lahat. Isa lang ang R mo, response mo sa ending, 3 p.m. Pwede mo isahin na lang response ng hyperthermia and ng abdominal pain niya nung 1 p.m. So, dalawa ang data mo sa hyperthermia. Isa, action sa hyperthermia. Then, another focus naman kay 1 p.m. nag-abdominal pain siya. So, anong data mo doon sa abdominal pain? Ilagay mo and action mo doon sa abdominal pain. Pero ang R mo, isa lang. At 3 p.m., so yan, patient was able to rest. Yung body temperature niya nag-decrease and negative na ang abdominal pain. So, ganun ha. Ganun sa, pwede pa, madaming FDAR. Isa lang R. Sa end of your shift. Okay, so next example. So dito, meron siyang date and time. Yes, good. Military time ang gamit niya. Ang problem is impaired skin integrity, right ankle. So pwede kayong gumamit ng nursing diagnosis. Pwede yan siya. Okay lang yan. Then data. So nilagay lang niya, gi-describe niya ano yung nasa right ankle. Slight serous drainage on dressing, wound 1/2 cm with left red border, no odor, states hurt slightly. Okay? Then action, anong ginawa mo sa impaired skin integrity? So cleanse with sterile saline, duoderm, thin applied. Okay? Nagbagong dressing ulit. Past tense ha. And then for the response, ano nangyari? Dapat may time siya dito sa response niya. Okay? Sa response, so wound na, malinis, wound clean, minimal drainage present. Then, name and signature sa taas. Okay? So, simple lang. Kaya ang focus charting pinakamadali FDAR. So, yan ang ginagamit natin ngayon. Next example, yan, may date ulit and may time. Kulangan na siya ng time dito sa may R response. Dapat lagyan ng time dito. So, focus niya, again, ano na siya, nursing diagnosis, pwede lang. Knowledge deficit, related to diagnosis. So, ano kayong diagnosis ng pasyente na ito? So, nandoon yun sa chart, makita natin. So, pwede na walang related to diagnosis ha, pwede lang knowledge deficit. As long as ma-explain mo sa data ano yung knowledge deficit niya. So, yan. Patient states she does not understand what her diagnosis means. No, hindi niya maintindihan daw. Or pwede quotation dyan, ma'am, unsa day akong diagnosis, ma'am, unsa akong sakit, wala ko kasabot, unsa ako ang sakit o diagnosis sa doktor nako. Pwede paki-explain. So, pwede yun siyang ilagay mo dyan as long as may quotation. Okay? So, action. Anong ginawa ng nurse? Illness explained to the patient according to her level of understanding. Then, patient thought symptoms she may expect and why she's having current symptoms. Treatments and procedures explained. Okay? Past tense ha. Then, response. Patient verbalized better understanding of her illness. Okay? Then, quotation. Kasabot na ko, ma'am. Salamat kaayo. So, pwede na yun. Kasabot na ko sa ako ang diagnosis. Name and signature. Kulangan na siya ng time. Okay? Pero dito, yun sabi ko, pwede naman din mag-doble-doble ka. Same date, 'di ba? Ito, same date siya. Time, iba naman ito siya. Ibang oras na siguro, baka na mali lang ito. Ibang oras, nagkaroon siya ng anxiety sa ibang oras. Okay, another focus. Anxiety. Pwede yan. So, patient says, I'm afraid of all this blood. No? So, yun, anong actions mo? Emotional support provided, encourage verbalizations, explanations given regarding treatments and procedures, family in to provide support. So, yung response mo, patient observed talking and laughing with family, states she feels less anxious. Name and signature. Then, may time lang dito. So, ma'am, what if dalawa pong focus ang nangyari? Dalawang problem ang nangyari sa isang araw? Paano namin isulat yun? So, may time dito sa first problem, yung DA mo. Pwede yung R, pwede wala mo na dito. Yung R na ito. Pwede isang R lang sa end lang, at the end of your shift. Pwede DA, then DA. Okay, then dalawa ang focus. Magkaiba lang ang time. Kaya itong anxiety, later part na nangyari. Okay, so, disregard itong R dito. Dapat ito na yun siya sa end. Ito siya, mapunta na yun siya dito. Understood her illness, and then patient observed talking and laughing with family. Isahin nyo na lang R sa end. So, pwede ganun. Okay? Okay, ito yung example na maraming nangyari sa shift ng nurse. Maraming problem yung pasyente mo. Okay, this is the date, the time, 9:15 a.m., high risk for trauma. So, ano daw yung trauma? Ang data niya, patient crying when I entered room, confided that she is afraid to go home because her injuries are the result of husband's battery. Okay? Ginabugbog siya. Okay, action. Attending notified and discharge cancelled. So, hindi natuloy yung discharge niya. Hindi na siya uuwi. Abuse network called with patient's permission and they are sending a counselor this afternoon to talk with her. Okay, yung action na ginawa ng nurse. Hindi pa siya nag-close. May another na naman, 10 a.m. Another problem. Nagkaroon ng pain yung pasyente natin. So, data ulit. Patient complaining of pain in right rib area. Okay, action. Anong ginawa ng nurse? Tylenol 3 mg administered as ordered. Okay, then 10:30, pwede na sa end of your shift, 3 p.m. Kung 7 to 3 ka. Pero dito, ewan ko ba't maaga siya nag-close, mga 10:30 a.m. Baka may mangyari pa later on this afternoon. No? So, iulit niya lagay ang pain dito for the response. Yan, patient reports relief rib pain, still anxious about aftermath of discharge. Okay, ang response hindi always positive ha. Say for example, may lagnat ang pasyente or may abdominal pain pa rin, pwede nyo ilagay still with abdominal pain with pain scale of 7 out of 10. No, pwede pa rin, okay lang yan na negative kung di talaga siya na-relieve. Sabihin nyo yung totoo. Okay? So, ganun ang ating FDAR. So, dito